Amazing. Good afternoon, everyone. Thank you so much for joining us for today's webinar, St Clair O'Conner Community, an Eden Model in Toronto, co-hosted by CARP Ottawa and Family Councils Ontario. My name is Taeyang Zhang. I am the Event and Project Manager at Family Councils Ontario. Today's guest speakers are Catherine Schalk and Charlene Go, and they will be introduced by my co-host, Carol Duke from CARP, following my short introduction. So before we start, I would like to take a moment to recognize the land on which we are gathered today. I am currently in Toronto, which is seated on the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis people. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. So we wanted to share a few logistics and housekeeping rules before we turn things over to my co-host, Carol. First, I would like to pull up this poll with a few questions for us to know our participants and from where you are attending this webinar. So I just going to pull it up. So there's 3 questions. Please take a moment to answer them. I'll just leave it on for my part of the introduction, and maybe for Carol's introduction as well, so you have time to fill it out. You'll also notice that all the participants right now are in listen-only mode. So we have reserved time at the end of the webinar for an interactive question and answer period. At that time, we invite you to use the Q&A box to ask your questions to the guest speaker, and Margaret Eisner from CARP will facilitate the Q&A session. And then please use the chat feature only if you're having any technical issues. And for your information, today's webinar is being recorded and it will be made available to participants and family. Sorry. Yeah, today's webinar is being recorded and it'll be made on our YouTube channel. So I'm now passing the mic to Carol.
Thanks very much, Tan. Welcome, everybody. I'm glad you could join us. CARP is a very large group across Canada looking at retired people who look after seniors. And QUAG, which is the long-term care advocacy group out of Ottawa, but we've expanded. We're not just in Ottawa. We have members in Hamilton and Niagara and up north, and looking at to make sure that families get listened to across the province. QUAG has put on a variety of webinars that are highlighting those various models that take the person-centered care into a new level of consistency and supported by standards. The webinars are all available on Change Long-Term Care Now if you want to have a little peek at it, and you can see a variety of them over time that people will tell you about their journey as they have adopted one of these models. Today's webinar will focus on that transition that St Clair O'Conner Community has undertaken with the Needham approach. Early impact on the changes that staff needed to take, as well as the administrative changes, job descriptions, the organization, are some of the things that they will look at. St Clair O'Conner has been open since '83 and has been an intergenerational community since that time. They started that whole campus crusade early. They were early adopters. St. Clair O'Conner is currently reimagining their long-term care by developing into a small house model. St. Clair seems to be doing it right, aiming for the small homes where real estate is really expensive undertaking these days. I'm a little jealous and looking forward to hearing all about their journey. Catherine is a nurse with 40 years of experience working in the industry, both on frontline, middle manager, and now executive director and CEO. She describes herself as a servant leader and believes that if culture can change, so can we. And it can have much better output for the staff, residents, and the community. After talking to Catherine, I agree that she is creative and innovative and knows there's always a solution for people to work together. She lives in Listowel, Ontario, with her husband, 2 kids, and 2 dogs, and an active theater group. We're delighted to have Charlene Govaretti with us. She's a co-presenter. She's a registered nurse and a certified Eden associate. She'll be able to share that clinical, practical view, having worked in the trenches, as well as the voice for a role model and a coach for the Eden program. Ladies, take it away.
Good afternoon.
Catherine's just sharing her screen in the
Can
pictures.
everyone see it now?
Not yet. Oh,
Okay, we're good now. So Charlene and I are colleagues here at St Clair O'Conner, and I've actually worked in with seniors and in long-term care specifically for this is going on to my 41st year. So I've been doing this since I was about 6. Charlene, not quite so long, but and I actually took a different path in my career. I started in a long-term care home in the 80s as a housekeeper, and and then I went to college and I was a PSW for a few years, and I always thought um, that we could do better. Some of the things I saw happening in long-term care homes in the 80s didn't sit well with me. So I always was on a quest to be better. Um, so we're not actually able to move our slides. Does someone else have control of our slides? Oh, there we go. So I'm going to turn it to Charlene.
Good afternoon, everyone. So as you can see, we have thank you, which normally you would see at the end of a presentation. But what we like to do here is to always start with an attitude of gratitude and really recognize, especially when we're teaching our own teams, our own staff, we want to recognize the work that we do here. It's often it goes unrecognized the things that we do, but actually it's very valuable when you think about it. When you're looking after a human being, it's one of the most rewarding things that you can do for someone. So that's why we have our thank you here as our intro. Okay. So the Eden alternative. So what even is Eden? Eden, when you think about Eden, it's the beginning of creation, of where Adam and Eve were placed. And another definition of Eden is like paradise, a beautiful place. And that's what we want to create here, is a beautiful place for the people who live here and the people who work here.
So St. Clair O'Connor's been around for 43 years. Um, and we're a little bit different than most facilities in that we're not a facility, we're actually a community, and we are a multi-generational community. We think we're the only one in Canada. I know of one in the States, but there's not so many around. And So I want you to think about that because it really actually, when we talk about Eden, it's very relevant to the Eden philosophy. And our core principles here at St. Clair O'Connor is that we're rooted in a faith-based understanding of the importance of community for healthy aging. And we're informed by scientific research, challenging a separation of individuals based on care levels as both artificial and isolating. And we'll get into that with our Eden stuff. But we are building here, we have 25 licensed long-term care spots. So we have capacity for 25 people that require long-term care. We have 126 apartments, and then we have 16 townhouses. And within our community, we have a variety of all sorts of ages. We usually try to keep 1/3 of our population under the age of 60. And the philosophy hasn't changed in over 40 years. So it's a long-standing philosophy here at St. Clair O'Connor.
Just looking back at the birth of the Eden Alternative, especially for those who haven't heard of it yet, it was started by Dr. Bill Thomas in the States. When he was a young doctor, he was eager to go see a patient about a rash on her arm. And he was quite confident. He knew what he was going to do, what he was going to prescribe for this lady. But when he went to see her after looking at the rash and thinking, okay, I've done my assessment, I've given my prescription, the lady actually looked back at him as he was leaving and said, I'm so lonely. And that kind of sparked something in Dr. Bill Thomas thinking, well, what do I prescribe for somebody that says they're lonely or loneliness? And that's when he started thinking about what's actually plaguing these facilities or these long-term cares. So he's identified that the three plagues of the long-term care or the facility is loneliness, helplessness, and boredom. And that's where he started the Eden philosophy, wherein he's focusing on those things. As healthcare professionals, we've always looked at the body, and we do pretty well looking at illnesses and diseases and how to treat them. But what Dr. Thomas has done was look at what's plaguing the human spirit and what to do about these things. So if you see here, we're not going to go through every single one, but one of the things we focus on and remind our staff and remind our teams and everybody that we work with, remind our people, these residents, most of them, when they come into St. Clair O'Connor, they don't leave. They're here until the ends of their lives. And we just want to remind everyone, this is their world now. And so is this world that you're creating good enough for them, exciting enough, motivating enough? Because they are living the last days of their lives.
So why Eden? So I've in my career, I've like I said, I've always wanted to do better and deliver better. And there's lots of programs out there. We've chosen Eden because it's widely practiced. And Charlene and I both went to the Eden conference this past June in Philadelphia. And there's people from all over the world there. And so we're like our own little culture. And it's about helping our elders live. And we don't focus on the medical and the diagnosis. What we focus on is building a home and finding joy. And the other reasons for Eden is that it increases the hope and the will to live, and it's a higher quality of life. And we see lower employee turnover with Eden, but it's a much more relaxed home when we practice the Eden. So the first things that we did when we started our Eden journey is we notified staff that they wouldn't wear uniforms any longer. We gave them a year to wrap their heads around that. And we'll talk about that. We'll talk about some of the outcomes we've seen with taking uniforms away, and there's a greater reduction in harmful drug use, and it's a positive impact on quality of life and financial outcomes and overall well-being, and we'll talk to that later as well.
So the eco alternative really is about culture change. We've already mentioned earlier, it's a philosophy. And it's really changing what we know now or what we've been doing in the past with the institutional model and making it better for the people that live here and for the people that work here. So we've always heard about person-centered care, and it's great. We look at what the resident or the person's needs are and try to cater to those needs. But taking it a step further is person-directed living, which is something that also came from the Eden alternative, wherein we really try to give all the decision making to the elder and those that are closest to them. So instead of a top-down kind of authority or hierarchy where everything comes from the director or the supervisor, we really bring it down to those that it will affect the most, which would be the elder and their care partner. So even our PSWs have a bigger voice than what they might have had in an institutional model. So that's something that we really are trying to embrace with the Eden alternative. So we're not going to go through every single one of the 10 principles, but the Eden alternative is guided by 10 principles, wherein the first principle identifies the plagues of the institution or the long-term care, which is loneliness, helplessness, and boredom. And then the other 9 principles are the solutions to the plague. So one of the things that's kind of our biases or stopping us from moving from an institutionalized model to this more person-directed living is ageism and ableism, wherein we think, elderly or people, our seniors or people who are in their 60s, 70s, and 80s can't really do much. They're frail. They can't be as productive, or they can't learn anything new, or they can't help other people anymore because they're the ones that should be receiving care. But I mean, if you look at these people on your screens, these are our actual residents, and they don't look like they're stoppable, really. One of our residents here in the graduation cap, that's actually her graduation from the computer class that we have here. And she's in her 90s, I believe, and she still did that. And it's quite amazing to see. So it's really our own biases that are stopping us from helping our residents grow. So it's one of the things that we look at. And ageism and ableism creates loneliness, helplessness, and boredom.
So a big part of Eden is actually moving from that medical model to a more social model. And we really try and look at the person and not their diagnosis. And so if it feels like an institution, if we don't empower our care partners, if we don't ever use any spontaneity, we are not acceptive of diversity, and we need to really look at companionships and human life and animals and plants. It's all part of what you would have in your own home. And part of Eden is teaching our staff how to receive as well as to give. So you have to allow the people you're caring for the ability to give back a little bit. And so that can look like many things, but it can just be a smile. But sometimes, our elders have all kinds of wisdom, and they like to share it with our caregivers. And so understanding how to receive that so that you make someone feel like they've actually given is one of the tasks we put our staff to. Um, and uh, I think that's probably all we need to say about that slide. We have a lot of slides, so we'll try and. So we want to talk about people who live in institutions, and usually it's, criminals, chronically mentally ill, cloistered nuns, juvenile delinquents, military recruits, our frail elders, and university students in dorms. And so we talk about that, and those are the kinds of people you would see that that live in an institution. The only thing, the difference on that list is that university students in dorms actually have a choice. They can leave. Most of those others cannot leave, and so that's a very important part of Eden.
So again, we emphasize that the Eden alternative or Eden is it's not a project, it's a philosophy. So it's the knowledge and it's the belief and the values that we have. So there's no start date, there's no end date. You can't really finish and say, we're Edenized, we've done our part, we are done. Because when you look back or when you look at it, really, these are people's lives. So there shouldn't be an end date. So within these domains of well-being, these are the things that we focus on within the Eden alternative. But you can always go back and forth. There's no timeline to it. It's really just kind of identifying and realizing the plagues and then doing something about it to eliminate those.
Yep.
So what is a care partner? So here it's not just PSWs or nurses in versus the residents. We really encourage the care partnership wherein there's a back and forth, like Kathy had mentioned earlier. It's not just about providing care to the residents, it's also learning how to receive care from them, which gives them a sense of purpose and empowers our elders as well. In the institution, it's typically one-sided, one-dimensional, where we're the ones giving care, but we recognize that our elders have so much experience, so much wisdom, so much knowledge to share to us. And that could be their way of caregiving. A lot of our elders offer us little pieces of candy and things like that, and that's their way of caring for us. We thrive when we have purpose and the opportunity to give as well as to receive care. And in the Eden alternative, this is the antidote to helplessness. So one of the other things we focus on is a difference between friendliness and companionship. So friendliness is somebody that says hi to you in the hallway and says bye, and that just smiles to you. But real companionship is when you take the time to know your elder and build real relationships with them, and the access to companionship is the antidote to loneliness.
So we have lots of slides. So all of the pictures in this presentation are actually people that live here at St Clair O'Conner. And it's a lovely community. We really encourage spontaneity. We really encourage creating home and bringing joy. And so we're gonna slip through these because we're kind of running, we have more slides than time. So, and I know that the slides will be posted so you can go through and read them. But some of the questions we ask on Eden, is it close to the elder? So that's in decision making. Like I'm the CEO here, so I really shouldn't be making decisions that affect an elder. It should be the person closest to them. So their care partner or a family member, the resident themselves, the elder themselves should be making it when possible. And even though someone might not be capable, there's always decisions that they can make. Is it continuing, and does it promote growth? So promoting growth is a big part of Eden, and that's opportunities for the elder to go to actively give as well as receive. That's part of growth. Meaningful interactions definitely are a big part of what we promote. I wanted to speak to medication, Charlene.
So because we said in the institutional model, we're always looking at the disease, the illness, and trying to treat them, with the antipsychotics, antidepressants, and things like that. But antidepressants and antipsychotics don't really treat helplessness or the feeling of loneliness or the feeling of boredom. So when we're using medication for those things, we're kind of not really using them wisely. But if we're using medications to treat infections, things that are actually physiological, then those ones are okay. That's the right way to use medications, but definitely not for loneliness, helplessness, and boredom.
So we're going to flip through slides. So we wanted to talk a little bit about what Eden can look like. And so part of what we are doing or in the process of doing is actually expanding our long-term care to a small house, small houses. And so our small houses, and I'll show you, again, the pictures are, the pictures say it all. We really do have engaged residents, and life is a party, and you should celebrate every day. But our small house model that we're going to, it's, a small house model typically is 6 to 12 per household. The typical institutional models are 20 to 32 in a neighborhood. The traditional is more of a nursing medical model where we're looking at quality of life and that person-directed care. This is this is part of our plan. So the yellow on this architectural drawing, that's our small house. So our small house, their small houses will be on a floor where there's actually apartments. And if you look at this, you can see every elder living in the small house, all 8 of them have their own bedroom. So they have their own private space. Each bedroom has an ensuite with their own shower. So that, that's pretty normal. And then they would come out into a kitchen area. All the meals would be prepared in the house, and residents would help make decisions as to what they want to eat. However, we still have we have Ministry of Health regulations that we have to follow. So there is a dietitian approved menu that will be put in every small house, but residents do have the veto power that if it's egg salad sandwich today and it's a nice day and we want to barbecue hot dogs, that's what they'll do. Um, eh, so for the mixed use development, I just want to talk a little bit about that. Because you can build a small house and you can have Eden, but the two sort of go hand in hand. You can build small houses that are institutional, but I think Eden's, for us, it's the magic that keeps it person directed so that we're actually servant leaders here. So our biggest agitation with building our small house is the Ministry of Health right now, Ministry of Long-Term Care. The Ministry of Long-Term Care has 2015 standards that we're held to, and they actually institutionalize more than so while they promote home-like, the regulations sort of get in our way sometimes. So you can read about it in our slides, but I think we've just gotten our last hurdle for approval. So it's been 8 months of back and forth with the Ministry of Long-Term Care to get an approval for our building. There are lots of advantages to small house, and part of it is when you're in a neighborhood of 32 residents, which I generally refer to as warehousing or seniors. They don't have a big voice. They basically, staff come in, they have a work routine, and it's a very task oriented environment. residents and elders that live in those larger areas don't have a lot of say in their day-to-day life. They're governed by calendars and charts and tasks. And so we're trying to take that out. So I know we're at the end of our time. Charlene's gonna talk a little bit about our observations since we've started our Eden journey.
So as you can see here, we have introduced some principles and ideas from the Eden Alternative into our long-term care space and for the entire community as well. And I just wanted to show you some examples here. So on the left, you'll see one of our residents and our brand new cat. We've had this cat for two cats actually for about 3 weeks. And she used to be, she's a retired nurse, used to be very, very confused and agitated and always crying and looking for her deceased husband and didn't really feel and find any purpose in anything. And she's always asking what she needs to do or where she needs to go. But since we've introduced the cats, she now has something to look forward to every day. We've seen such a big change in her demeanor and her mood, and she's happier and more calm, and now she looks forward to going to see the cats in the morning and helping feed and helping fill their water bowl and things like that. So but it's not just her. A lot of our other elders have also enjoyed having the cats around, and it again goes back to the spontaneity, because animals are very spontaneous. They don't go by your schedule, they do their own thing. The other thing that you see in the upper right is when we've taken uniforms out of the picture, where we used to all wear scrubs on the floors, and now we wear plain clothes. Our residents actually feel we've taken away the hierarchy of staff versus residents, and where the staff are usually seen as the decision makers when you get up, what time you're going to eat and things like that. That's actually been taken away, and that's just from taking uniforms away. So now our residents kind of recognize and see our staff more kind of like as friends and or partners, and sometimes they even think they're like their grandchildren, and they build better relationships that way. And then the bottom right picture, we've added more plants. I mean, we've always had plants, but we've added more plants, and in our future build, we want to have more outdoor space, because some of our residents really find joy in gardening and planting and looking after the plants, and that again gives them purpose. So these are kind of small changes that we put in, but we've really seen the difference in how our residents react and interact with our team.
So we just did a 3-day education in 32 minutes. So we're open to questions or comments, or if anybody has suggestions that we should try, we're always open to that too.
So thanks, Catherine and Charlene. And while I'm waiting to see the questions come up on the Q&A, maybe if you put your PowerPoint down, that would help. Good. And while that's happening, I'll just say that it's really nice to see your slide presentation where you start with gratitude. Thank you. I've worked with staff a lot in my life, and nothing goes further than to say thank you. And you appreciate staff, and it's nice to see that, to see that welcoming. Just a couple of questions that I had when I went through, and maybe just for clarification. So you talked about is terminology. Would you call the residents elders, or do you call them residents?
So that's the $1 million debate here.
Okay.
So it's very common in Eden circles to call everyone an elder. And elder in Eden language just means someone who's wise and has answers. It doesn't, but here some of them feel they don't want to be called an elder because it depicts older people. So we do lots of learning circles here with our residents So that's one that we'll put to our people who live here, like, what do you want to be called?
Okay.
You know, some of them say, well, we're citizens. We want to be citizens. So
Right.
I use Elder because I've used it probably for 15 years. And we were taught Elder, but it basically it's whatever the people you serve, it's what they're comfortable with and what they like. So
Well, that makes sense. And then this flip side was care partners or staff. Then you used that, I think, Charlene, and family members are family members. That's how you. That's the terminology, correct? Yeah. Okay.
yes.
Okay. And then the other question I had was, you have 25 residents now in long-term care, but you're moving. You've got funding. You're moving towards a new building.
Yep.
Are the existing 25 residents are in an Eden alternative model, correct?
Yes.
But
Yes.
you're building this new building that will have areas of 8 or so.
Yeah. Yeah. So we've been
homes.
granted another 23 beds. So we'll expand
Okay.
from 25 to 48, and we'll
Right.
have 6 small houses of 8 people.
Okay.
And our staffing model will change a little bit. And we've actually started moving towards that change in the staffing model so that it will be 2 staff that actually go in and do everything in the house with the elders.
Right.
And so,
Okay.
but also, you know, involving the elders in to keep their space tidy and clean and um you know, with the cooking, like it's, you know, elders, it's normal to take part in preparing
Yeah.
your meal. And um, so yes, so we're looking at PSWs, but then we cross-train them.
Right.
So
And when do you anticipate the building to start? And
well, once we get all the approvals,
yes.
so we with our first submission to the Ministry of Long-Term Care was last August with the drawings. And it came back with about 18 pages of changes we had to make.
Mhm.
And so that's been back and forth with them because we fix one thing and then they find more. And so our last submission, which was 2 weeks ago, it came back with 2 recommendations and we fixed those. So we're anticipating approval soon. We've had to give up a lot, so that's a whole nother story.
Right.
Because they really do, they want the act says that you must have a medication room, and like whose house has a medication room? You know, it's a tub room. They want a tub room in every household, and we actually wanted, you know, 1 or 2 spa areas that we could take people to. So, but we've had to sort of go back and switch. We've had to put a lot of proactive. Well, what if someone gets burned on the stove? So a lot of that kind of stuff. You know, even though we keep saying, but we're building it for adults, it's not for children. Like adults, you know, there is a risk. There's a certain level of risk in life, and I don't think it's our job to tell other people what level of risk that they should be taking.
Right. Right. Okay. And so for Catherine, or Charlene, I mean, if I could just ask you, you talked about no uniforms and residents are more relaxed and so on. And I could see that in the pictures for sure. Did you have a difficulty transitioning to staff not wearing, was there any pushback on that?
Definitely. There was
Definitely.
definitely a lot of pushback, especially at the beginning, because they were saying, but we've already bought our scrubs, we've already, invested in so many sets of scrubs. But I think as we taught the staff what it would mean for our residents and really show them kind of what it would look like, they slowly and like Kathy said, everyone was given a year to really think about this and prepare and maybe collect a few pieces here and there that we could wear to work. Eventually the staff did switch over to no uniforms, and
Right.
now they're quite happy about it, because the other thing that we may have missed in the slides is that if you're wearing, plain clothes, it also helps the residents be a little bit more aware of what's going on, like what the weather is like, what season are we in, as opposed to wearing scrubs
Yeah.
all year long. They have no idea because everybody looks the same every day. So
Yeah.
now they have a little bit more insight, even if they don't ever leave the floor, they know, oh, it's winter or it's summer, or maybe it's Valentine's Day because the staff are wearing pink and red and things like that.
Right. And so again, Charlene, for education then, um, do you have a special program? Do you follow a special curriculum with new staff when they come on, the new hires, or even the staff who are going into the Eden Alternative for the first time? Did you have a program? How did that look?
So we did develop a 1 day education for our staff, and we're slowly rolling that out. We haven't finished everyone's education as of yet, because other things come up, but we are working on it. So we do small groups of our current staff and do the 1 day education. And then for anybody that's new joining our team, we introduce the idea and let them know that this is something that we're working on and something that you should expect if you want to join our team. And it's not going to be, your typical institutional model. And I think that's been helping with the transition as well.
The other thing I just wanted to mention
Yeah.
on that, we actually have one of our seniors that live in our community is also a trained Eden educator like Charlene and I. And so she can actually help deliver some of that education.
Good, excellent. Now, programs, you talked about ageism as an issue, and it certainly is an issue in terms of our view. And it's nice to see all those pictures that you showed us of residents enjoying themselves. I enjoyed those. But what programs do you offer then? And what kind of things? I noticed you had a graduate, so there was somebody taking a technology course. Other things that you do?
So we do some of the traditional stuff, but we would get shot if we stopped bingo all over our building. But so for instance, we have the police coming in to talk about elder scams and but then, some of it's just the spontaneity. So the cats themselves are actually a program
Right.
because it's a spontaneous thing. We just, SCOC was built 43 years ago with a pool, an indoor pool. And so we've just received a grant and just finished the work this week. We've filled the pool in and made it a big space for, there'll be a spot for horticulture, a spot for some art, so some creativity. And then it's almost mind, body, and soul, because then there's also a spot for exercise equipment and people to work out. So people can go down and do that at any time. We also, we've bought bread makers, and our seniors in our long-term care home, we do try and make bread frequently because there's nothing more like home than the smell of homemade bread. We also have a tea room in St Clair O'Conner. And so part of our programming for our elders that live in long-term care is they actually go down to the tea room and have coffee and tea and visit and talk to people and see what's going on in the street.
I saw the picture of that on your website. I was quite taken with that. It looked very
Yeah.
nice. So we have a question here, with the Eden model, and you talked about loneliness and boredom and so on. Do you have any elders who have blindness, who are blind? And if you did, like how would you help them in terms of removing loneliness, lessening it, boredom?
So we do have an elder in our long-term care. She's not completely blind, but she is quite visually impaired. And actually, the cats is something that she really enjoys because the cat could sit on their lap and they can pet the cat and things like that. So even though she's not able to fully engage in something like bingo, those are the other things that she enjoys. The cats, we have a lot of music and movement and things like that, those kinds of programming, and those are the things she can really participate in. So we have a drumming circle. So she likes that. Yeah, she likes anything really that has music. We have some
She does the chimers
the
too.
chimers.
Yeah.
We have entertainers that come once a month. She enjoys that a lot.
Good suggestions. You mentioned at the beginning, Catherine, 25 licensed long-term care beds, 126 apartments, 16 townhouses. And you talk then later about Eden model and the multi-diversified funding being available if you have this, complex kind of community model, if you like. Are there common areas or in your plan or right now where some of the people in the apartment will get to see those that are in long-term care? So I'm trying to visualize how they're getting together, or are they?
So we have in our current community, we have a large meeting room.
Okay.
So we do lots of parties, and long-term care residents frequently will go down, especially if there's special entertainment.
Okay.
They'll go down. But we also have a big outdoor area. So in the summer, we do barbecues and we try and get everyone to go to those.
Yeah.
Tomorrow night, we have a big Easter banquet. And so it's building wide. So lots of
Okay.
family and it's kind of a big deal. We have turkey or ham, and
Right.
we have both. You can have one or the other. But it's all about including families and making
Right.
sure that everyone has their loved ones. And when they don't have loved ones, so we do family dinners in our long-term care area every 2 months, and families are invited. But for those that don't have families, we actually have some elders that live in the independent living that
Okay.
we invite to come in and be companions to our long-term care residents
Oh, that's
so
great.
that they
That's
have
good.
someone with them.
Yeah.
But lots of people in our long-term care home have actually come from our community. So they're
Right.
well known. Some of them have lived here for many years. So
Good. I have a question here from someone who lives in Windsor, and she's involved with the Transformation Committee with CARP, and she's trying to encourage their community to look at models of care. And she's been working on this for over 3 years without much success, even though they've tried to involve politicians and community leaders. And she'd like to know any suggestions you would have to kind of get this moving.
just keep swimming. So I will tell you it's not easy, and I will also tell you the province of Ontario is probably behind, and we need to advocate. I was I had the privilege of actually presenting our model in Winnipeg back in November, and they had some government officials, and um, it seems like they might probably get ahead of us. Our regulations make it so hard to do anything innovative. Because even though we're building something that might be a little, we think is better, they're still holding us to those regulations. And so because they've been around for forever, I understand the regulations and I understand usually the terrific, horrific moment that made things change in our legislation. And I know that there's reasons for 40 years why we've got the regulations the way we are. But I think we have to keep advocating for better, and the regulations don't necessarily make it better. The regulations still maintain it to be institutional medical model, and I don't believe that we're doing the best for our elders in keeping the warehousing of seniors in big 600-bed facilities. That's just, to me, not the way to go.
Right.
So
Yeah.
advocate.
Advocate. Good. And have people then that you can call on, maybe some champions maybe to help. Did you have champions to help you, or were you, how long have you been doing this advocacy work for this?
So I've only been at St Clair O'Conner for 2 years, but I've actually done the advocacy and the culture change for 15.
Uh-oh, Windsor, are you listening? 15 years.
So I led culture change for some other bigger for-profit companies actually.
Right.
So there are good things happening in the province, but it's really hard to get licensed
Right.
small house projects approved. And I'll tell you why I'm passionate about making sure they're licensed. Because you can build a small house model and you can charge people exorbitant money to live in them. But I really believe in that um, care for all, and everyone should be able to afford it. And so when you're licensed, you're actually funded. So that means anybody in the province can actually afford it.
Mhm. There's a couple of questions here that talk about dementia and so on. You talked about behaviors, less medication use. You talked about less staff turnover, I believe, in that. So you are evaluating. You're keeping some stats, obviously.
Yep.
And are you working with any educational institution to do this on a more higher level, or are you just doing satisfaction surveys, or how are you
So
managing your stats?
we do satisfaction surveys with our residents every year, and that's required under the act. But we also have a big quality program. So we take a look at our antipsychotic drugs, we take a look at our falls and all of that kind of stuff. And all of that sort of relates back, and it's the analyzing all of that. So we have stats here from the last 15 years that we can look at and see an improvement. But the Ministry of Health actually, because there are things that we have to report to the ministry annually, and we all
Right.
have to do the quality improvement plan. So the ministry watches that stuff too.
Yes, absolutely. How many of your, say, 25 elders right now need total care? Like they're not too functional.
Um, Total care, I would say about half of them.
Okay. Yeah. So they're requiring quite heavy personal care then to get moving and whatever. Yeah. Okay. Which I think is probably the norm. But you also said that you have a certain percentage of people that you admit under the age of 60
That's in our community,
in
not
your
necessarily
community,
in long-term
not
care.
long-term care.
Yeah,
Okay.
so long-term care, but even though we still have implemented, no matter how much care someone needs, we still try and give them choice
Right.
and a little bit of spark in their life. And I think that you have to um, experiment a little bit with someone, but the more you can give them for decision making and ensuring that they try things,
Mm-hmm.
the better off it is for the person receiving the care.
Right. So the Eden model works for someone needing total care, in your
Oh,
opinion?
yes, absolutely.
Yeah. Okay. And certainly you have, well, the cat was the pet therapy is a great thing too, that I'm sure helps. Do you now you talked a bit about programming, Charlene. So um, do you have people come in, provide music? Like, do you have special staff doing this, or do you just have community groups coming in, to do things?
We have our own in-house activation recreation team.
Okay.
And they do the daily kind of activities, but we also try to have special activities for our elders. It's either once a week or once a month. So we do have music therapists that do come, and they're the ones that do the chimers and the drumming sessions. We invite um, art therapists to also come in and do that with our elders. So there are different things, I mean, different people that we do invite to come in, plus our own in-house team.
Okay. Good. Catherine, you wanted to add something? Sorry.
Well, I was just going to mention we do have some exciting stuff coming up.
Good.
So we have an adult day program here as well. So,
Good.
and those kind of things sort of all run together. Um, but we got some funding to run a kids summer camp here this summer.
Oh, wonderful.
So more of our intergenerational, and our elders will be involved in some of that.
That's exciting. Good to hear that. Do you, by the way, converse with other Eden alternative models that are out there? And I know there's a few. Certainly the big
Yes.
one we know is in Saskatchewan.
Yes, and
But
Sue Ellen's my best friend.
okay, perfect. And so you can kind of pass ideas, I guess, off and,
Yeah,
yeah,
yeah.
that's great. That's a good thing.
We actually
Um,
send our staff that do the 3-day training, we send them to Sherbrooke. Because
oh,
Sherbrooke also runs a small house model.
yes,
So,
exactly. And so my last question, because we've kind of run out of time. Those design standards for long-term care were done in 2015.
mhm.
And there's been a lot of talk since COVID about small house model. There's been talk. People use the language, but not necessarily do it. And our advocacy work at CARP is all about changing institutions to homes. What do you think we need to do to get those design standards changed?
So I'll tell you one thing that really drives me crazy right now. So we have this building that we're designing has like the small house. So we have a small house on 6 different floors, but the rest of that floor would be apartments. But under the standards, we actually have to almost put our seniors in a bubble so that they don't come into contact with anyone else on the floor. So we
Hmm.
have to add glass partitions and so that they actually don't, and we have to assign an elevator that just goes to long-term care houses. So I think it's ridiculous. That's not part of being a community and that's not part of being a neighborhood. We've designed different ways so that you can see people, but it's not interacting. So I don't know, something needs to change, and I would advocate for those standards to be looked at. I think they're trying to protect people since COVID from coming in, and the standards are 2015, but it's the interpretation of the standards as well.
Right. Yeah.
So
I guess everyone's struggling with that who are looking at new kind of models and so on. Anyway, it's been a delight and I've enjoyed listening to your journey. And so thank you, Catherine and Charlene. It's wonderful to hear what you're doing. And I'd like to invite you back once you get your new building up and
we'd
see
love to.
how things are going. And we'd love to get an update from you. So once again, thank you so much for joining us today. Very informative. And I'll now turn things over to Taeyong.
Yes, thank you so much, Margaret and Catherine and Charlene. I'm just gonna put myself perfect. Let me just amazing. Um, So thank you so much to CARP Ottawa for co-hosting this webinar and for Carol and Margaret for being here, welcoming everybody and our speakers, and of course, Catherine and Charlene for this wonderful presentation. And also thank you, our audience, for being so participative and having such good questions. And as a reminder, this webinar has been recorded, so it will be made available on Family Councils Ontario's YouTube channel early next week, and you can find the slides on there as well. And we also have another webinar. CARP Ottawa and Family Councils Ontario is co-hosting um, on May 14. It's a Wednesday, 12 to 1 on the William Osler Health System. So I will put the registration link in the chat. It is also going out in our e-bulletin today. So if you are not subscribed to it, please feel free. And let me just put it in the chat so everybody has it. Amazing. So thank you so much. If you have any questions, if you have questions for speakers, you can email me at events@fco.ngo and I'll be happy to forward them. So thank you for joining us today and have a good rest of the day. Thank you.
Thank you so much.